Pursuant to Deped Order No. 28 Series of 2018 entitled Policy Guidelines on Upland Kalusugan sa Department of Education, all public schools are encouraged to observe a nationwide school health and nutrition programs. With this, Quezon Integrated School features the 6 major Deped school health programs: School-Based Feeding Program and Gulayan sa Paaralan Program, National Drug Education Program, Water Sanitation and Hygiene in Schools Program, Adolescent Reproductive Health Program, Medical, Nursing and Dental Services, and School Mental Health Program. In Quezon Integrated School, the feeding program of the Department of Education was launched to address short-term hunger among public school children. Through the years, the program underwent changes in target beneficiaries, coverage, delivery mode, and focus, and that is from addressing short-term hunger to that of addressing undernutrition. As of school year 2018 and 19, based on the last assessment made by the district nurse, it came out that out of 60 feeding recipients of Quezon IS, there were 57 or 95% recipients which were rehabilitated to normal status. The 3 or 5% remaining recipients were still undernourished, which will be given immediate intervention for the school year. The commendable result of the SBFP was attributed to the appropriate compliance and practice of SBFP guidelines as to creation of SBFP core group, nutritional assessment conducted, food safety standard and menu followed, daily feeding supervised by the school head. The school's Gulayan sa Paaralan program directly supports the feeding program of the school. Hence, various vegetation grown in the garden were directly channeled to the feeding program. More so, to assure the children gets the proper nutrition not only in the school but also at their respective homes, the community were encouraged to put up family home garden. In addition to those practices, the school strictly observes essential healthcare programs such as deworming, hand washing, and toothbrushing activities. SBFP recipients were trained with good table manners, proper food consumption, and cleaning of their utensils after eating. The Department of Education is strengthening its National Drug Education Program to protect students from the adverse effects of dangerous drugs. NDEP is a comprehensive education program which provides a holistic approach in preventing and eliminating the threat of drugs in the country. It also enables all sectors to work collaboratively with the school system as the core, thereby unifying all sectorial endeavors. It has 5 components that the Deped builds on to create awareness on the ill effect of using illegal drugs. These components are curriculum and instruction, co-curricular and ancillary services, teacher and staff development, parent education and community outreach, and research monitoring and evaluation. Every child has the right to a quality education, which includes access to drinking water, sanitation and hygiene services while at school. Children spend a significant portion of their day at school where wash services can impact students' learning, health, and dignity, particularly for girls. The inclusion of wash in schools in the Sustainable Development Goals represents increasing recognition of their importance as key components of a safe, non-violent, inclusive, and effective learning environment, and as part of the Universal Wash Access, which emphasizes the need for wash outside of home. Adolescence is a period of transition from childhood to adulthood, during which adolescents develop biologically and psychologically and move towards independence. Although we may think that adolescent is a healthy core group, many die prematurely and unnecessarily through accidents, suicide, violence, and pregnancy-related complications. Some of the serious conditions of adulthood, for example, sexually related transmitted infections like HIV and tobacco use, have their roots in the adolescent behavior. To prevent these various problems, as early as 11 years old, grade 6 pupils of Quezon IS underwent Adolescent Reproductive Health Program orientation conducted by Tagbina Rural Health Unit medical personnel. The Department of Education shall intensify the provision of medical and dental care to public school learners and personnel through an expanded universal medical and dental checkup. health intervention, and health and nutrition education. Such activities complement and supplement government's accelerated efforts to mitigate hunger and poverty among the populace. To sustain the national awareness, consciousness on health maintenance drive throughout the year, Quezon IS, together with public and private health professionals affiliated with medical and dental associations and organizations, continue to conduct healthcare checkup and seminar to children, teaching and non-teaching personnel. School is one of the best places for both educators and students to become increasingly aware of mental health problems, and mental disorders. Mentally healthy children are more successful in school and life. Good mental health is critical to children's success in school and life. Mental health is not simply the absence of mental illness, but also encompasses social, emotional, and behavioral health and the ability to cope with life's challenges. Generally, Uplan sa Kalusugan aims to promote and provide all learners and Deped personnel with holistic school health and nutrition program towards healthier behaviors and healthy, better learning outcome. Let us all join to extend full support to and participation in this program. God bless us all.